Autologous Conditioned Plasma, ACP, is a new technology that concentrates platelets and growth factors within a plasma layer separate from white and red blood cells. Outside of the bloodstream, platelets become activated and release proliferative and morphogenic proteins. These growth factors are known to be important for healing. A small amount of blood is withdrawn from the patient in a manner similar to a laboratory blood test. The double syringe system is then placed in a centrifuge and spun for 5 minutes, concentrating the platelets and growth factors within the plasma layer, separate from other blood components. When centrifugation is complete, the double syringe is removed. The yellow plasma layer is then transferred by gently pushing down on the outer portion of the syringe while pulling back on the innermost plunger. The inner syringe is then twisted in a counterclockwise direction and removed. A needle or cap is placed on the syringe for use at the point of care.